Federal agents call it a pandemic loophole, netting millions of dollars to fraudsters and using the elderly to rob from taxpayers in just a matter of weeks.
ABC 27's investigative reporter Katie LaGrone speaks with a federal agent on the case and explains why victims never knew they were being exploited.
I don't know what this is. Is this a knee?
Yes, that's a knee.
Anna Adams shows us the loot she was shipped last year.
I kept telling these people that kept calling me that I did not need braces and I did not need a back brace or a knee brace or anything at all.
It prompted her to call authorities.
I'm just reporting that it's fraud, that I did not order them.
At 90 years old, Adams is one of millions of American seniors who each year are shipped durable medical equipment, including braces they don't need or want. And this DME is used by thieves to cash in on hundreds of millions of dollars in fraudulent Medicare claims.
What is this?
But since the pandemic, this brace scam has loosened up, bringing back what federal agents haven't seen in years.
No storefront.
No product.
No product.
doctor.
The patient has never heard of the DME company, and the patient never received anything.
Federal agent Ryan Lynch leads the Medicare fraud strike force team on Florida's West Coast.
So what are they getting? Just a phone call?
Nothing.
Back in March, when the feds declared a state of emergency over the COVID-19 pandemic, the Centers for Medicare and Medicaid Services temporarily halted mandatory on-site visits to newly established durable medical equipment companies. Lynch says that was the welcome mat to an age-old scheme.
What they did was open up their DME companies, get certified, no site visit because of the pandemic, and then immediately bill huge amounts in the millions in just 4 to 6 weeks.
To date, the feds have identified at least a handful of fictitious medical equipment companies that opened and shut within 2 months, all in Florida, specifically Fort Myers. At least 2 of the companies, Lynch says, even applied for PPP loans. While the company shut down before any PPP cash could be sent, Lynch says they had already made out like bandits.
In a span of time of 6 to 8 weeks, they're billing in Medicare and they're making upwards of $3 million in 2 months. That's how fast.
In August, the feds ended that temporary halt to on-site visits, leaving any new medical equipment company to once again be visited by the feds.
Was this narrow window of opportunity something that only a few people capitalized upon? Time will tell.
Suspension sleeve.
Meantime, Miss Adams plans to donate her box of unwanted braces.
Hey, Tandra.
Jay.
I helped you with your case.
On the day we visited, she met the local guy who is helping the feds build a case that continues to prey on seniors.
What do you think this box is worth?
$1,600
$1,600?
to $2,000. Yeah. That's what they would bill Medicare.
At the expense of all of us.
The big takeaway, healthcare fraud hasn't ended with this pandemic, and in some cases, it's gotten even worse. So a reminder, never give out personal information. Check your Medicare benefits summary. And if you happen to receive equipment you didn't order and didn't want, make sure you report it. We have details how on our website. Katie LaGrone, back to you.